Good morning, and thank you for joining us. My name is Seth Washington, and on behalf of Prestige Community Resources, in partnership with Amerigroup, M&T Bank, Bread for the City, the DC Department of Behavioral Health, as well as Karen McConnell Jones and VNP Media, we welcome you to this, our third installment of a continuing conversation around building community resilience amid COVID-19. As we also acknowledge July as Minority Health Month. This event, by the way, is being recorded and it will be replayed and available to you on the Prestige Community Resources website located at www.prestigecommunityresources.org. And please feel free while you're on the website to create a contact profile. Prestige Community Resources is focusing today's symposium around the theme of mental health matters. It takes a village, with particular attention being paid and light given to special minority populations that evidence disparity in healthcare outcomes. Disparities in healthcare reflecting barriers that can be physical as well as attitudinal. Here to assist us in locating solutions and enhancing our resiliency is a stellar panel of thought leaders assembled from within our very own village, including Jackie Reyes Yanez, Director of the DC Mayor's Office of Latino Affairs, Jamilia Hampton Diggar, a Senior Program Manager in the area of permanent supportive housing, Imani Walker, the Family Engagement Coordinator for DC SEED at the DC Department of Behavioral Health, and Earlene Budd, a non-medical case manager and a recognized leader in providing individuals with effective tools to survive. We'll be hearing from each of these ladies shortly. At this time, we welcome an individual who is also a thought leader in these areas that are being discussed today. As well, he is the founder and CEO of Prestige Community Resources, and he is here to present this morning's welcome address. It's my pleasure to introduce John S. Smith, Jr.
Thank you so much, Seth, for the introduction. And also I want to thank you all, the panelists, for coming on board to make sure that we make this month a success one. As you all know that as a minority, we facing a lot of challenges when it comes to stigma and challenges in terms of being able to receive care and access care. And as you all know that in our community, we've experienced a painful effect due to all this long history of stigma from the media, stigma for other people of varieties in terms of how we can all receive care. Especially in this time of the COVID-19, we have over 100,000 people who have actually lost their life in death, and which actually expose this disparity when it comes to people receiving services, especially the minority community. So our goal is to make sure that we come together as a provider and group to be able to reduce this stigma and also increase the awareness of this stigma. And like Seth mentioned, the topic for this month is basically for all to come together because it takes a village. It's not just one person who can do this. It's not just one agency. It's not just one organization. But if we come together as a group and make this huge difference, then we will see that we can begin to move a needle in terms of how we can provide a competent care and reduce this stigma in our community. And I just want to kind of thank you all for the time to kind of come down here to have this conversation, have this discussion, to see how we can do together. And as an organization, Prestige, our goal is to make sure that we spearhead that mission, the vision to make sure that we reduce this stigma, to provide these services for those who have these needs in our community. So as we be having this discussion about inequality and also helping the community to be resilient to this stigma that's been going on for years. Please, if you have any suggestions, any advice, things that you feel that we all could do to make this work, to be able to make it successful, we are more than happy to receive this. We are more than happy to accept this. So we are more than happy to kind of continue to initiate any ideas that we may come up today and continuous and consistently making sure that we build a community of resilience among the minority population among our team. So thank you so much, and I appreciate you coming on board. And thank you, Seth, for taking that ownership and being able to kind of sponsor. I'm not just sponsor this event, but being the MC for this event. Thank you so much.
Thank you very much, John S. Smith Jr., and we appreciate your welcome words this morning. And we are now preparing to receive our 4 panelists today. And as we prepare to do that, we will be hearing from them first, each individually, for 15 minutes apiece. And then later on, we will have a question and answer period. And we want to welcome you for joining us in this occasion. This is our 3rd installment, and we want you to know that we will be receiving some of your questions. Also, you can use the chat room to post your questions at the time of the question and answer period. And so right now, I bring forth our first speaker today, Jackie Reyes Yanez. Mayor Muriel Bowser appointed Jackie Reyes Yanez as Executive Director of the Office on Latino Affairs, not once, but twice. Director Reyes Yanez has lived in the District of Columbia since 1990 and is the first Salvadorian to run the agency. Director Reyes Yanez has been a key player in the design and implementation of the Immigrant Justice Legal Services Program. In her previous position, she served as Director of Latino Affairs and Community Outreach for former DC Council member Jim Graham of Ward 1. While working with Councilman Graham, Director Reyes Yanez led initiatives to address the needs of Latino residents in the district. She also was a case manager at the Latin American Youth Center and at the Office of the Mayor of Community Relations and Services under former Mayor Adrian Fenty. With more than 15 years of experience and commitment to Latinos in the District of Columbia, some of her most important accomplishments are the historic Sister Cities Agreement between Washington, D.C. and San Salvador, efforts in gang prevention, and helping to secure funding to rebuild the Monsignor Romero building in Mount Pleasant, Northwest Washington, D.C., that was destroyed by fire in 2008. Please join me in welcoming to our conversation today, Jackie Reyes Yanez.
Thank you, Seth, for that introduction. And I would like to say, also greet everybody who's in this very important mental health forum. I'm like, as you read in my bio, I am a product of Washington, D.C. and the beauty of Washington, D.C., that we are in the nation's capital. And we are here, I like to always say this, that we are like a ray of hope to the nation, right, during this pandemic. And thank you to Mayor Muriel Bowser, that she's a leader and she has come up strong, advocating for all, that we all Washington, D.C., and especially during this time, we're all together. And having said this, I would like to say a few things of who we are. The Mayor's Office on Latino Affairs has been in office since 1976, and it was because the people who advocated for this office, and then we have all of this umbrella of African American, Asian Pacific Islanders. It was because a group of Latinos felt that they were not reaching out to the mayors. They didn't have the eyes and ears of they didn't have the ears of the mayor to advocate for us. And it took Mayor Bowser to put somebody, I like to emphasize that I'm the first Salvadorian. We're the biggest immigrant community in the area. And Mayor Bowser appointed me first as a Salvadorian after 40 years of this office. And I say this because when we are talking about building community resilience, we have to know who we talking to in our community and understand the cultural awareness that it takes. One thing that me being Salvadorian, my father immigrated here in 1980, didn't have the tools to become an advocate for himself. Now 40 years later, 30 almost 40 years later after he came, his daughter is leading this office, this advocating for in the mayors and vice versa, being that bridge in the community for people, especially in this pandemic times. And one thing that I have feel proud is that we have to reach our Latinos where they are. We are right now, we have kept our office open since the pandemic because our community doesn't have computer access. They are under fear because of everything that is going on at the 1600 Pennsylvania Avenue with the president, inverting fear of like getting services. And when we talk about building community resilience, we cannot build resilience when our people are not coming out for services, for human basic needs services as a doctors, you go getting your COVID test. Our first Latino that died of the COVID that didn't want to get in the ambulance because he wasn't documented. You know, that's how much our community is suffering. So I would like to say another key points that we are 13% of the population of Washington, D.C., 10%. And we Latinos, we share common languages, but our cultures are very different. Our values and beliefs vary from country to country, even in the region, from region in our countries. So it takes one, you know, if we have not been poor, we don't know what is that to have not to have and not to have. So in the difference from different areas from the Latin American region. But in Washington, D.C., we're in every single neighborhood and also in all the socio-economic classes. So one thing is to learn about who we are. So a very important cultural competence with minority communities. The cultural competence is priority for the Mayor's Office on Latino Affairs. We work across the board with the other agencies and creating best practices and policies that will make services and resources more accessible to Latino community and language limitations. Since the pandemic, Mayor Bowser has been very bold on making sure that everything has been translated. And this has been I would like to take pride that this is the first mayor who has done that. When we had that case of the gentleman who didn't want to get in the ambulance because he didn't have documentation, the very next day we were doing a press conference. The mayor came on and said, "You don't have to be afraid. We're not ICE agents here. We are service providers in the Washington, D.C." During the emergency, Mola is part of the district response COVID-19 Joint Information Center. We are talking to our agency partners on how to reach the Latino community and other departments, producing the community, and all the information is accessible to all of our constituents. On this new normal, we are adapting to use the new tools to keep the Latino community members engaged with the Bowser administration services. We send out text messages because everybody has a phone, and to keep them informed and engaged with the office. We also have some virtual support groups as a WhatsApp group. It's becoming very popular. It's called Somos Washington, D.C. And I have stakeholders. We have stakeholders and everybody to disseminate the information. We have added legitimate information and available services that can they have access and share their friends with their friends and their neighbors. We also provide interpretation and translation services such as the language line solutions, which is an essential tool to ensure community members receive the same experience and services when accessing government resources. It's always a good idea to keep a current and the demographics of the communities. the communities that you serve, and build relationship with community partners as trusted messengers. You can get feedback about the cultural appropriateness and respectful of our services. So with that, I would like to say that while we are transitioning to the new normal, we also need to work together as a community. And we're all in this together. And thank you for having this very important, because you are taking the time to get to know us, and you're taking your time to get how the Latinos live. And you might have a neighbor that doesn't speak the language, because I always, like my African American friends, says, oh, I have Maria. Maria is the she needs help with this. So thank you to our African American and everybody here, because when you see somebody in need, you're reaching out to us. So please also get my information and my office information, that we're here together. And if you see somebody in need, if you see a Latino or any other immigrant member in need, reach out to us, that we're here to help. And don't forget, very important, don't forget on wearing our mask in public spaces is mandatory now. Keep our social distance and good hygiene, like washing our hands regularly, and which is vital to keeping ourselves, yourself, your family, and our community safe. So with this, I would like to say that I'm glad to be a part of this great panel. Mil gracias. And now if you have any questions, please don't hesitate to ask me.
Oh, thank you very much. And we will be getting to a question and answer period a little bit later on. But in the meantime, Director Jackie Reyes-Llanes, from the Mayor's Office of Latino Affairs, we thank you very much for those insights and very timely words. And we look forward to touching base with you to get some more insights from you later on in the program. As we move forward with the discussion, we bring forth into the conversation Jamilia Hampton Diggar. She is a social engineer, strategist, and 21st century leader who partners nationally and internationally with CEOs, executives, providers, churches, and leaders to address issues plaguing communities abroad. As a native Washingtonian and a product of the foster care system, serving families and children with histories of mental health, substance use disorders, and economic and educational disparities, this has become a duty for her. Jamilia has spent over a decade working in the social service field with residential camps, after-school programs, leadership institutes, intensive in-care, in-home counseling services, and the chronically homeless in Washington, D.C. She is the current chaplain of the Association of Christians in Leadership. She serves as chancellor of Blue Ridge Christian Leadership Center and has been licensed as an elder since 2011. Jamilia is a certified national peer with NAADAC and DCAPC. She serves as a trainer for Jordan Peer Recovery. Jamilia has plans to go to medical school to learn the art of healing. Her goal in life is to impact nations and change her generation. Jamilia holds a BS in psychology and an MA in counseling psychology from Bowie State University. Please join me in welcoming to our conversation, Jamilia Hampton Diggar.
Hello, thank you so much for that great introduction. Thank you, Prestige Healthcare Resources, for this opportunity. Welcome everyone that's joined today. It is an honor to be here. It does take a village. I love the statement, so it does. I'm gonna be here to discuss aging out of foster care and family housing resources for DC residents. Let's see. Do I need to share my screen, or let's see. I can share my screen. Let's see. Let's see. Sorry, guys. My apologies. Let me see.
No problem. I have it if you need me to just show it.
Sure, please. Thank you.
No problem.
Awesome. Thank you. And so I'll just start with, if you can click to the next slide. I'll start with my journey. So this is a photo of my family, circa 1986. I ended up in the foster care system as a result of substance use and untreated mental health with my parents. And this photo is my grandmother, who was 60 years old when I was born. She was 64 in this photo, and I was 4 years old. There's my twin sister, my baby sister who was 2, and my brother who was under 1. I spent 4 years in and out of the foster care system, in and out of homes. And I was a ward of the state until age 18. Luckily for me, unlike a lot of children in foster care, I was matched to family. The first few years I was not. There wasn't family to take us at the time. And so by the age of 18, I was headed to college. It was a wonderful milestone. My grandmother was excited to have made the promise to my parents, who were deceased by then, that she would make sure that we were attending college and moving towards independence. However, the barrier that I faced with this pending adulthood at 18, right, was that I wasn't sure what that term meant, other than that I was considered an adult, but I wasn't prepared for what was ahead. And some of those barriers had some implications. There were financial implications of adulthood. I had no understanding of budgeting, credit. I didn't understand how credit and budgeting was tied and closely connected to housing. And so for me, it was a scary time. I was on my way to college, but I had no idea for what was ahead, because most of the supports that I received, a lot of the work was done for me in foster care with the case managers and caseworkers. And then this picture, this is us over at the social service office in DC, actually, with supervised visitation with my parents back in 1986. Luckily for me, college meant that I had 5 years to figure out in a safe space how to navigate adulthood. And so that meant I had housing for 5 years. That meant I had food for 5 years. That meant that I was able to get a job on campus and try to support myself and begin to kind of learn some of those skills, those life skills that I was not afforded the opportunity to learn while in foster care. And with the promise of a degree at the end of that, employment would help me avoid homelessness and things like that. So when I got to college, I searched for mentors, anyone willing to help me learn about life. I volunteered. I became a life student. And so college was extended foster care for me. Next slide. And so here are a few statistics or some information that I just wanted to share about aged out youth. Nationally, there are about 165,000 older youth from ages 14 to 21 that were in foster care in 2017, which is a huge number of youth. With a lot of the services and advancements since 1986, that's still a huge number of children who are in foster care and who will age out of foster care. Statistics show now that about 23,000 children per year age out of foster care. And 18% of those at age 18, 20% of those that age out will instantly become homeless. And so if they're not matched to familial supports, if there aren't relatives willing to take them, if they're not able to find programs that will take them, they'll end up homeless because they're considered adults who can take care of themselves. Extended foster care is associated with better young adult outcomes. Older youth in extended foster care from ages 19 to 21 just have better outcomes compared to those youth who've never been in extended foster care programs. The statistics also show that youth who have just had a year of extended foster care do better than those who have not been touched by extended foster care or emancipated at 16 and didn't have additional supports after 18. Next slide. So what do our youth need? In order for them to appropriately address homelessness and unemployment, early or unintended pregnancies, mental health and substance abuse. They need a safe place where they can learn the coping skills, the decision making, impulse control, and a safe place to seek out independence. We all remember what it felt like at 18, you boundary test. And extended foster care will provide aged out youth that opportunity to safely be linked to opportunities to receive services that will help them foster permanent connections in the place of family. And it's not intended to replace family, but they'll end up being able to connect with some permanent supports that will help them gain the life support that they need to address some of the traumas that they may have experienced while in foster care, to be able to work through identity and work through rejection and abandonment. They'll have a safe space to be connected to supports where they can do that safely. And of course, as I said before, extended foster care has the best national outcomes. And so extended foster care is used to support children, again, when they don't have family support. The next thing that our youth in foster care need are housing opportunities. They need to be matched to programs so that they can work without fear of thinking that they're going to be homeless. In a lot of the foster care programs, housing isn't stable. They kind of are shifted around and they go from place to place. And so having them match to those housing opportunities prior to emancipation, age 15, 16, and 18 are going to be very vital for them so that they can focus. We all know, according to Maslow's hierarchy of needs, is that if our basic needs are met, we can move towards self-actualization. And so we can then begin to work on our goals. And just like DC's Housing First model, which has the same agreement that if people's basic needs and shelter are met, then they can focus on the other things that life brings, or life issues as I would call them. So our youth need housing opportunities. The next thing that our youth need would be peer support. There is, for 18-year-olds, there is a peer support specialist type of program where that matches foster care youth to other foster care youth for supports. Because at 18, aged out youth, they really have very few skills and little support. And so having peer support specialists connected to them is going to be amazing. We all know what the peer support does for the recovery space, matching peers to those with lived experience. We all know also teachers use the positive peer culture where they create an environment where the students kind of police the classrooms and hold each other accountable. And so peer support for foster care youth is a vital resource and a vital support. SAMHSA suggests that mentoring prepares youth for adulthood. And so mentors would be a great support for our aged out foster youth. Especially, and it may be the only persons that the foster youth have come in contact with that will work with them on a voluntary basis without pay as the incentive. Foster care youth need a sense of belonging. They need to feel connected to someone, and they need to know that people are genuinely wanting to help them. And so the peer support specialist piece is going to be vital because they're matched at 18, and by 24, they'll gain the skills that they need to be successful. The last part of what our youth need is life skills training, and they'll get all of that when they attend extended foster care programs. Next slide. So, and I won't go through each resource, but the Young Women's Project is a DC-based organization, and they have a foster care campaign. A wonderful campaign. It is probably if you print it, it's probably 3 to 4 pages, and it really outlines what to do, prepping or planning for aging out of the foster care system. And the planning starts at age 15, all the way up through their 20s. Okay? And so our youth will be able to participate in various services starting at age 15 in order to help them avoid homelessness. And this toolkit is amazing. It's coupled with resources from the city, CFSA, and this website specifically is catered to DC youth. And so just a little about the Young Women's Project and their foster care campaign. Their mission is to build the leadership and power of foster youth so that they can transform their own lives and improve the child welfare system. What I love about this program is that it starts at age 15 and it goes to age 24. And they really help them get involved, everything from their civic responsibilities with lobbying, reaching out to city council to advocate for foster care programs and foster care dollars. And then by the time they're 18, they're mentoring those under them. And this specific DC-based program is youth-led, youth-ran, which is that peer piece that I talked about just a few minutes before. And so in this toolkit, you're gonna see that you'll have housing resources. If you can go to the next slide. You'll also see who to contact if they don't know who their guardian ad litems are, if they don't know who their social workers are. It gives step-by-step guides, numbers and email addresses for persons in the city who are responsible for helping them navigate in that space. Next slide. It'll also have a lot of collaboratives. These collaboratives are really important because they are in the city with the resources available to help families and individuals move towards self-sufficiency, which includes Far Southeast Family Strengthening Collaborative, East of the River Strengthening Family Collaborative. Next slide. A few more collaboratives and Catholic Charities. All of these programs offer case management services specifically for foster care youth, okay? And they are skilled in navigating the age out process. Next slide. So I'm gonna talk a little bit now about housing for families. In this slide, it says nearly 60,000 families are without a home, but if you look, DC is in this corner right here with the highest rate of homeless families in the nation, and that's a problem. And the mayor's office, along with DHS and some other providers, have been working to end homelessness. The rate has decreased in 2019 by 11.9%. And DC plans to end homelessness with 3 options. So there's permanent supportive housing, rapid rehousing, and targeted affordable housing. Next slide. And so PSH is the program where clients are matched to services who are street homeless or have episodes of chronic homelessness. They also are the most vulnerable because they have barriers that prevent them from maintaining stable housing, such as substance use, mental health, disabilities, their income, problems with education and training. And so these are our most vulnerable homeless residents in DC. Rapid rehousing is the next program where if you have some financial challenges, you've lost your job, you just kind of need a little hand ahead, some financial support, but you need very little assistance. You already really know how to navigate resources. You've just had some hard times. Rapid rehousing is the program that you'll be connected to. And then TAH, Targeted Affordable Housing, is the same type of programming or housing, but you don't have the case management support. Now, permanent supportive housing is my favorite because you get lifelong support. As long as the families want housing, they'll have the case management support to help address those barriers that led to homelessness. And for PSH, our job is to obtain housing, maintain housing, and then help you address those barriers that led to homelessness in the first place. Next slide. And so case management is imperative with families that are looking to navigate housing in DC. Case management is important. If you connect to case management, these are individuals skilled, they know the resources, they'll take all of the work out of it for you. It's really helping families open up and trust the resource. Ask questions, families need to get support, be open and honest about the process, because if our context is off, our conclusion will be off. And so we want to help you. So being honest is imperative. And then trusting the process, being open to learning how the program operates, and then being open to the suggestions of case management. Next slide. So DC has 3 ways that you can gain housing in DC, whether it's through Virginia Williams Resource Center. They screen and assess families and place them. DHS has their permanent supportive housing program where you can walk into 64 New York Avenue and be assessed for housing. And then the family collaboratives are all touch points who are skilled. Their case management staff are skilled at navigating housing. So if you end up touching any of the collaboratives I mentioned before, you can gain housing and they'll help you with the voucher process through DCHA as well. Next slide. So here are a few housing resources, and there are so many. When I submitted the presentation, I also sent a link to DC resources, and that's hopefully the participants can be emailed this presentation afterwards so that they can utilize the emergency rental assistance, the housing resources through DCHA, furniture resources, employment and training resources. What I love about the Office of Work Opportunity is that we've been able to work with them, and instead of 10 families receiving job readiness, the additional dollars for job readiness and workforce development, we've been able to foster a partnership with them that allows our families to still receive those weekly incentives, which is $75 a week, $300 a month, while working on housing navigation. And so it falls into alignment with Housing First, because if their basic needs are met, they'll be able to focus on training, employment, and maintaining their jobs. Next slide. That is it. Thank you so much for listening, and I look forward to the questions you all will ask later on.
Thank you very much, Jamilia Hampton Diggar, for those great insights. And we certainly will have some questions for you as well. So please, thank you for sticking around with us, and want to remind everyone who is joining us today, thank you again for being with us. And please provide us with questions in the chat for both Jamilia Hampton Diggar, as well as Jackie Reyes Yanez, and our other speakers who are coming as well. Additionally, for today's event, we want to ask that if you want to leave contact details, please do so on the website, www.prestigecommunityresources.org, and complete a contact profile. As we continue our conversation, I want to introduce our next speaker, Imani Walker. She is the Family Engagement Coordinator for the DC Social Emotional Early Development Project, also known as DC SEED, at the Department of Behavioral Health. Imani is a lifelong DC resident and is the proud mother of 4 children and grandmother of 4 beautiful grandchildren. Modeling resiliency, Imani has effectively used her personal journey to healing to become an advocate for families dealing with intersecting issues of violence, trauma, lack of access to appropriate family-centered services, and criminal justice, as well as child welfare involvement. Her goal is for families, by virtue of their own lived experiences and expertise, to authentically and persuasively use their voice to affect systems change. For the past 20 years, Imani has trained parents and caregivers in leadership development and policy advocacy. Within these areas, her efforts for the expansion of family-centered treatment services have been recognized by the Substance Abuse and Mental Health Services Administration, the White House, and its Office of National Drug Control Policy, the United Nations World Health Organization, along with a host of other prominent organizations. And her awards also include features in the Ford Foundation's Leadership for a Changing World Award, the Red Book Magazine's Mother and Shaker Award, Essence Magazine's Power List of 28 Most Influential Black Women, the Oprah Magazine's Giving Voice, and BET's Black Girls Rock Trailblazer Award. Please join me in welcoming to our conversation, Imani Walker.
Unmute, Ms. Walker.
Ms. Walker, are you on mute? Please join the conversation with us. Take yourself off mute.
Thank you.
Thank you.
Can you hear me now?
Yes, we can. Welcome.
Okay, wonderful, wonderful. Well, I'd like to thank Prestige Community Resources for inviting me to speak on this topic. It is near and dear to my heart, and I'd like to also acknowledge and thank at this time our leadership here at the Department of Behavioral Health, Dr. Barbara Bazron for her investment in families and family behavioral health services in the District of Columbia. And additionally, she's a fierce supporter of peer support services. So I'm grateful for that. As we focus on minority health disparities in healthcare outcomes amongst special minority populations, I'm particularly honored to raise up the experience of family leaders that I work with. I'm a certified family peer specialist and recovery coach trainer. And I come into the work as a result of my lived experience and determination to use my personal suffering to affect systems change. What I'd like to focus my remarks on is specifically building community resilience. Resiliency is a term that is ubiquitous these days. It is literally everywhere. Resiliency is the reality of our lives. Most of us that are African American, Black, Brown, LGBT communities, we know intimately resiliency. Resiliency is ingrained in our culture as African Americans. It is that quality that helped us survive slavery, Jim Crow, the civil rights era, poverty, various drug epidemics, community violence, mass incarceration, and the list goes on. We thrive not in spite of adversity, but we are made stronger because of our experience of adversity. It is in the real life experience and expertise of our families that the catalysts for systems change and reform lie. In my position as Family Engagement Coordinator with the DC Seed Project at DBH, it has been my goal to help create a space and opportunity for family voice and leadership. By convening leaders of family-run organizations, parents, and other caregivers who are currently navigating the behavioral health system and other intersecting services within the system of care, and allowing space for their articulation of needs, barriers, gaps, and strengths within the system, and ultimately their recommendations for improvement. We provide a safe space where trust is built and leadership is supported and developed. Our efforts have led to a family advocacy initiative of family leaders known as DC Families United. DC Families United is a family advocacy initiative addressing the needs for increased family partnership within the system of care. DC Families United is led by family leaders, family peers, and family-run organizations. DC Families United believe in the inherent dignity and resiliency of families. During this time of the COVID-19 pandemic and the time of social unrest, DC Families United meets weekly as a group to provide one another support. In addition, we hold Tuesdays Together, which is a weekly parent support conversation open to all parents in the district. It is based on the World Cafe model, which focuses on protective factors. Just to list them, the protective factors are social connections, nurturing and attachment, knowledge of parenting and child development, parental resilience, social and emotional competence of children, and concrete supports for parents. I am, as was stated in the introduction, Family Engagement Coordinator for the DC Social, Emotional, and Early Development Project at the Department of Behavioral Health. And DC Seed has a summer series of virtual workshops, especially designed for parents and caregivers. The workshops focus on topics such as self-care, wellness, perinatal wellness, social emotional development, and early childhood development. The workshops are held on Tuesdays and Fridays. And for the flyer for those workshops, please look on DBH's website, which is dbh.dc.gov, and click on the Children and Families tab, and the flyer is attached there. Also, DC Seed provides positive parenting training that is done by Cognito. It's a virtual training that any parent can access at any time at their own leisure. It is a positive parenting program online resource that can be accessed directly by caregivers of young children. It can be accessed via internet, connected mobile device, or laptop. The resource includes both information and interactive role play scenarios where learners can practice handling challenging situations with young children. I believe it's also on DBH's website, but the web address, if not, is www.cognitocampus.com, and any parent can go there, create their account, and the enrollment key is DC Parents. So I just wanted to list some of the resources that DCC provides. And then our focus at DCC, like I said, is social emotional early development. So I would like to also list the early development services of the Department of Behavioral Health. So at DBH, we have Healthy Futures, which provides early childhood mental health consultation to District of Columbia early childhood development centers and home child care providers. Healthy Futures is a prevention-based service in which mental health professionals join with families and child care staff to promote healthy social emotional development in children. Healthy Futures provide on-site mental health consultation services designed to increase the capacity of teachers, other child care professionals, and families to address the needs of children with challenging behaviors. You can also go to dbh.dc.gov and click on the Children's and Families tab to access information about Healthy Futures. To tell you a little bit more about the DC Social Emotional and Early Development Project of DBH, it is a 4-year SAMHSA grant that will be ending soon. And it is to support the expansion and strengthening of behavioral health supports and services to young children 0 to 6. DC Seed has an early child mental health consultant as well who provides programmatic and child-specific consultation services to early childhood providers within DC child development centers. In addition, the consultant provides professional development opportunities for center staff and families. DC Seed also provides mental health treatment services. DCC clinicians are trained in 3 evidence-based treatment programs: child-parent psychotherapy, parent-child interaction therapy, and strengthening family coping resources. They focus on strengthening the relationship between the caregiver and the child. And we provide those services at Community Connections, Mary Center, and MedStar Georgetown. The Department of Behavioral Health also provides Parent-Infant Early Childhood Enhancement Program. The PEACE program's mission is to provide culturally competent, community-based mental health services to infant, toddlers, preschool, and school-age children ages 8 and under that are responsive to individual family needs. Mental health clinicians provide early childhood intervention and treatment services, which provide family-focused behavior management, counseling, and therapeutic support to caregivers and families. And for more information, you can contact Ms. Charmaine Bowden at charmaine.bowden@dc.gov. It is also on DBH's website. And lastly, the primary project is a prevention and early intervention program designed to reduce mild adjustment difficulties of identified children in pre-kindergarten, 4th through 3rd grade. Primary project child associates provide one-to-one non-directive play sessions to young children. These sessions help to improve school-related competencies and task orientation, behavior control, assertiveness, and peer social skills through play. That you can also find that on DBH's website. So I felt like it was really important to be sure to cover the services that the Department of Behavioral Health offers for our families. And with the time that I have left, I will just talk a little bit about my personal experience and how it is I came to do this work. So as stated, I'm a single mom of 4, and when I was newly divorced and struggling to take care of my children, I had fallen into a very deep depression. I had experienced domestic violence, and I sought help initially for, my depression issues. Over time, the depression, I was languishing in my depression, and over time, I began to self-medicate and fell into a substance use disorder. And at that time, I'm 21 years in recovery, and at that time, it was really difficult for me to access appropriate family-centered services. So I went in and out of inappropriate services that were not gender-specific or trauma-informed. And needless to say, I was not able to achieve healing in those programs. And it wasn't until I received services that were family-centered and that also focused on my children in addition to my addiction and my own depression. Because as you know, when the parent suffers, the whole family suffers. And so once I was able to get into appropriate family-centered services, I was able to achieve personal healing. And what really stood out for me was the time between me first trying to access appropriate treatment and then eventually accessing appropriate treatment. And I bring that up because that's the reason that I took the time to really break down the services that are available for our families. And I encourage you to go to DBH's website because, I hear sometimes things like, oh, is the person ready to change? And certainly there are stages of change. We know that, we all learn that. But from my own personal experience, what I know that there was a length of time between me first taking the initial step to seek services and then me accessing appropriate services. That length of time did not have to be as long as it was. I was certainly ready. I just was not finding what was appropriate for me and my children. So I'm happy to say that we have these services, and especially, of course, my focus at this time is the early intervention services that we provide. At the time, I had an infant child, and it was really important that he was able to get the child-parent interactive therapy that DCC provides through the 3 core service agencies that I mentioned. I think that's all I wanted to say. I do want to, I think, end by talking about the importance of family voice because of my experiences navigating different services. So there, I had intersecting issues. There was the substance use. There was my involvement with child welfare. There was my involvement with TANA. Through navigating those intersecting services, our families are able to best inform us of where the gaps are in our services. So, I believe in creating spaces for authentic family engagement and family voice. Thank you.
Unmute, Seth.
Pardon me. Thank you very much, Imani Walker. We appreciate all of those great detailed insights, and we thank you in advance for remaining with us so that we can have access to more of your insights during our question and answer period that we're coming close to. We have another speaker coming up, Earlene Budd, but before we bring Earlene Budd to the fore, we want to take a moment for a Prestige commercial break regarding our phone drive. And as well as we approach that, I want to bring to the microphone at this time a man who is well immersed in matters of community resiliency around mental wellness, and himself a COVID-19 survivor. So he is a very present example of resiliency. I want to welcome now the president of Prestige Community Resources, Will Bonnet. Will, you're on mute. Okay, there you go.
There we go. I want to thank everybody for their participation. I want to talk a little bit about what Prestige does and about our phone drive. Prestige has, as the president of the nonprofit arm of a larger healthcare company, our job really is to support the healthcare company, but also provide services to the community, and many of which are not funded or that are not, they may be underutilized. It may be some issues that, we may develop some innovation. And what I'm trying to say is that, what we try to do is work on Maslow's hierarchy of needs, looking at some of the needs of the community, because we want the community to be able to rebound, to have continued resilience. We want the families and individuals that are in the community to grow and to thrive. One of the things that we do at Prestige is we have a phone drive. And we found that the homelessness problem in the district is actually pretty bad. I want to bring up some statistics here that I can focus on. Give me 1 second here. Roughly, we're looking at more than 7,000 individuals who roam the streets of Washington, D.C. We're located on the corner of Minnesota and Good Hope Road, and I can tell you, right across the street from the agency in which I work, we have roughly 20 to 30 individuals that sleep in the park at night. We work in an area where there is not only substance use, but sex trafficking, poverty, homelessness, and a myriad of other problems. And there are some solutions that we try to employ to make things better and to make access better to healthcare. One of the things that we do is we have a phone drive. And the importance of phone drive for the homeless people has to do with their survival, impact, and the quality of life. And 1 in 4 homeless in the Metro DC area are without a functioning helpline. Out of the 7,000 individuals who live on the streets, nearly 28% of them have life-threatening or terminal illnesses. Okay, unfortunately, connection is a rare commodity for people who are homeless. And you know, the reality is healthcare in a privatized healthcare system or healthcare delivery system can be a very elusive thing that a person who is homeless and without supports may not be able to access. Prestige realized that phones can increase emergency response timing by about 98%. On the streets, healthcare and healthy lifestyles are next to impossible, which can create health emergencies in the blink of an eye. I did direct services for over 20 years, and I can tell you, I've had consumers die because terminal illness, homelessness, lack of access. Prestige last year gave away 100 phones. And we're talking about smartphones with phone plans. We have entered into a partnership with AT&T where we can purchase phones at a reduced amount. And on top of that, we're able to attach a phone plan that has unlimited text, talk, and data. So far this year, we've given over 86 phones. And you know, our goal is to be able to do maybe 250 phones. It really doesn't cost that much. What I did was I went onto the Prestige website, prestigecommunityresources.org, right? There's a donate link button on there. I decided I'm going to donate $30 a month. And it automatically comes out through my PayPal account. That $30 a month is enough to provide a person with, you know, support. In that regard, you know, we came up with the tagline, give a phone, save a life. So I'm encouraging everyone to think about what you can do to help our community become more resilient. I do think we have a very resilient community. Unfortunately, I also think that we are faced with some of the worst crises that we've ever seen in the history of this country. Between COVID, the social justice issues that we're currently revealing to have other roots, such as poverty, and the opioid epidemic. You know, just the other day, I came out of the facility and you know, someone had left about 15 hypodermic needles in the dirt next to our building. And you know, I never thought that the opioid epidemic would be as bad as it has gotten. And I think that, you know, we as individuals and as organizations have to do our part. One of the things that we're doing is a phone drive. I'm going to encourage people to support it. And you can do that by
Do you know you can be part?
I'm sorry. I think that's probably my cue, and I may be over time.
Do you know you can be part of something great? Do you know you can change a life right from your home? You can help us save poor families living in local communities in D.C. from the pain and depression of being underserved with basic amenities by simply donating to cover their phone bills. It's that simple. Our campaigns have helped over 2,000 people with about $56,000 in donations and 25 active volunteers. We'd love to do more. Join us at Prestige Community Resources and make the world a better place. Click the link below. donate.prestigecommunityresources.org.
Thank you very much for that information, Will Barnett. Text Save a Life to 202. Pardon me. I'm going to continue right now with our next speaker, Earlene Budd. Earlene Budd is a 61-year-old transgender woman constantly fighting to make a difference in the lives of transgender people and other members of the lesbian, gay, and bisexual LGBTQ community. Earlene works as a non-medical case manager at Helping Individual People Survive, also known as HIPS, in Washington, D.C., serving transgender, lesbian, gay, bisexual, and other individuals. She is one of the founding members and former executive director of Transgender Health Empowerment, Incorporated, founded in 1996. Earlene is the executive director of Empowering the Transgender Community, also known as ETC, a new grassroots 501c3 nonprofit organization which will provide an array of services for transgender people in the DC area. ETC's mission is striving to serve, empower, support, and save lives daily. Earlene has over 25 years of experience in working with special populations and those struggling with substance abuse, mental health, homelessness, and HIV/AIDS. Earlene has 2 years of college and is eager to continue her education in social work. Earlene is one of the District of Columbia's first transgender women to serve as a commissioner in the Office of Human Rights. She also serves as a liaison to the DC Department of Corrections on transgender issues and is a member of the Department of Corrections Transgender Advisory Committee now for over 15 years. Earlene recently received 3 honors. In May of 2019, the Trans Equality Now Community Builder Award. June 2019, she served as a Capitol Pride Grand Marshal, and in September 2019, she received the 2019 March for Trans Equality Louis Bates Torch Award. Earlene was most recently honored by Impulse Group DC in the May 2020 edition of her outstanding work in the community. She describes her everyday hobby as wanting to just help somebody. Please welcome me in joining to our conversation, Earlene Budd.
Thank you so very much. I'm so humbled at this opportunity to be a part of this wonderful panel today, as Mr. Barnett had reached out to me and indicated he would like for me to join and do a brief presentation. My name again is Earlene Budd. I am considered as the advocate. I'm 61 years old, a transgender woman of color, and I just enjoy what I'm doing. You know, I often say to myself that if today were the last day of my life, I have lived a full life. I'm an addict. I'm HIV positive. I've had colon cancer and survived it. And today I'm still kicking and moving on as we come in every day and we sit out front during these terrible times and we table and help those that are most in need. Just every day knowing that someone comes by the table looking for just a piece of bread, but in this case, we give a full meal, a DHS meal, and also hot meals from the neighborhood restaurants that are donated to. So I'm very humbled to be here at HIPS as a non-medical case manager, but also very proud of being the director of Empowering the Transgender Community here in Washington, D.C. So thanks, Will. Thanks, Prestige, so very much for inviting me. I'm going to go very quickly through my presentation because I wanted to just kind of touch on different things that were, to me, were of importance. And the title of my presentation today is Improving the Wellness of Transgender, Intersex, Gender, Queer Individuals, being provided by me, of course, Earlene Budd, Executive Director of ETC, Non-Medical Case Manager here at HIPS. Next slide, please. So overview is that we envision a future in which people with mental health, substance abuse, use disorders pursue optimal health, happiness, recovery, and a full and satisfying life in the community via access to a range of effective services, supports, and resources. We pledge to promote wellness and take actions to improve the quality of life and increase the longevity of people with mental health, substance abuse, and use disorders. Next slide. There are 8 dimensions of wellness, and one starts out with emotional, and ultimately you end up with financial. And I will ask to make sure that Will is able to provide, and I'm sure they will, copies of these slides that I'm presenting today. Much of the information that I'm quoting from and presenting has been presented and developed by SAMHSA, and I did a training webinar with Iden McCullough of the Ida Mae Campbell Center. So that's where you will also be able to find additional information. Next slide, please. Language today. We're going to be talking, and you're going to hear me speaking about is transgender, which is an umbrella term for individuals whose gender identity and or gender differs from their assigned sex at birth. Transition, the process through which individuals go as they change their gender expression and or their physical appearance through hormones or surgery, but not always physically altering their body. I want to just make it clear that a person that is transgender does not always have to have gender reassignment to feel complete. I, as a transgender woman of color, have not had any transition or surgery, and I'm very comfortable with my life in terms of where I'm at. You'll see terms like F to M, standing from female to male, sometimes called trans man or transsexual, male to female, which is sometimes called trans woman or transsexual. Next slide, please. Continuing on with language, genderqueer is one that is very important today and very fluent. It's an umbrella term that includes all individuals whose gender varies from traditional norms. This also includes individuals who are born anatomically female or male, but feel their identity is neither female or male. Intersex, an individual born with male and female anatomy, unclear genitalia, and or varying chromosomes. Let me highlight something about intersex individuals. I've had the opportunity through the Department of Corrections of meeting several intersex individuals, and what I know is that usually people say, how do you identify someone as intersex? One or the other, in some kind of way, there will be, one of the genders will be more pronounced than the other. Always ask what pronouns or terms an individual uses before using them to identify someone. That means simply, if you don't know and you're not sure, in a very private way, ask the question. Next slide. Gender. Gender is a socially constructed classification system that ascribes qualities of masculinity and femininity to individuals. An individual's sense of self as masculine or feminine, regardless of external genitalia. Words that refer to gender include man, woman, transgender, masculine, feminine, genderqueer. Gender characteristics can change over time and can differ between cultures. Next slide. Invisible minority. A group whose minority status is not always immediately visible, such as the individuals with disabilities and transgender, genderqueer, intersex, TQI individuals. The lack of visibility may make organizing for rights difficult. We need to create a safe spaces for transgender, queer, and intersex individuals to come out if they wish. There are people today who identify as such, but they're afraid to come out because of discrimination and other issues. Next slide, please. The Harry Benjamin Standards of Care. I felt it was important to include this in my presentation. Harry Benjamin was a medical from 1885 to 1986, was an endocrinologist by trade, well known for his work with transgender, then known as transvestism community. And in 1979, the Harry Benjamin International Gender Dysphoria Association was formed. It is now called the World Professional Association for Transgender Health, WIPAD. Now, I want to just make it clear that, my apologies, I want to make it clear that when we start talking about the Harry Benjamin Standards of Care, many, especially those of us who are transgender women of color, we choose not to go through that process because there's a process with it where you go through, you see a mental health, you have to go through a couple of years before you can get permission to transition and to state that you are who you are. Many transgenders today, especially I'm speaking of color, find themselves getting black market hormones, silicone, as you've seen, in the face and the hips and the body and those kind of things, and decide that they don't want to go through the Harry Benjamin Standards of Care. Next slide, please. The Harry Benjamin status of care also allows professionals to understand how they may offer assistance to those in the community, are flexible and allow individualized treatment, and discuss the role of the provider, the patient, diagnostic assessment, psychotherapy, hormonal therapy, and surgical therapy. Next slide. Now, the National Discrimination Survey Report on Health and Healthcare. Transgender and genderqueer individuals across the country reportedly regularly facing discrimination in the form of denial of health. Medical providers' awareness of the individual's transgender status increased the likelihood of the individual experiencing discrimination. Next slide, please. So some of the key findings in medical and mental health statistics. And as you note, I said no information shared is not current, but provided as indicators of health statistics reported for this population. High levels of postponing medical care when sick or due to discrimination was 28%, and inability to afford was 48%. Significant hurdles to accessing healthcare, including refusal of care, was 19%, and the number was higher amongst individuals of color. Harassment was at 28%, violence 2% in medical settings. And next slide, please. The epidemic levels of HIV infection, including overall 2.6% have HIV, compared to versus 0.6% of the general population. And I'm sure that's much higher today again. Among transgender women, 3.76%. Amongst unemployed, 4.67%. And we've definitely seen surveys, I believe one that came out of Casa Ruby and also the Office of Human Rights that showed much higher percentages of this. But I felt that we needed to at least put this out for folks to give them a sense of the things that are going on and the lack of in the trans community. Those who have engaged in sex work, 15.32%. Current or past use of drugs or alcohol used to cope with TIQ-related discrimination, 26% or higher. Extreme levels of suicide attempts, 41%, compared to 1.66%. Low income and sexual and physical assault significantly increased in this risk. Next slide, please. So delay in seeking health care. Again, remind you that these numbers are not current, but just something I wanted you to have an idea to see, you know, in terms of what SAMHSA had done and what that study looked like. Many individuals delaying seeking health care due to fear of previous experiences with discrimination from providers. 48% delay seeking necessary health care, and half delay seeking preventive care. Refusal of care by gender identity, as you can see below, the numbers are highlighted of the total sample that they did versus male to female, which was at 22%, female to male after M was at 19%, and gender nonconforming was at 6%. Next slide, please. Discrimination by medical providers. Again, percentages are definitely much higher today. Denial of healthcare occurs in multiple places, including, and I need to highlight this, in doctors' offices and hospitals, emergency rooms, mental health clinics, by emergency medical technicians, as was in the Tyre Hunters case, and in drug treatment programs, and could be much higher today in 2020. And as you see, some of the numbers at the bottom are there. And again, I believe those numbers will be much higher. And I hope that by doing this training that we might, in fact, have the Department of Health or someone to decide, or the council to decide to do an updated assessment of our community. Next slide, please. Health care insurance. Genderqueer respondents had lower uninsured rates at 17%, than female to male at 19%, and male to female at 20%. And if you look at the graph below, again, you will see the disparities in terms of the differences as it relates to Asian, Black, Hispanic, White, American Indian, and multiracial. I'm sorry. Next slide, please. So mental health care, which we're talking about today, rates of those who have received transition-related counseling. Now, what we knew back then was that 75% related to gender identity. Transgender were more likely at 80% than genderqueer non-conforming at 48%. 89% of those who medically transitioned and 91% of those who had some type of surgery. That all these numbers are very important, but again, I am just so hopeful that, you know, by doing this training today, that someone will say, well, we need to do this study again, so that we can have some real numbers in terms of funding needs also. Next slide. Suicide attempts by employment. The total sample was 41% of individuals. Their employment was 37%. Unemployed was 51%, 55% lost jobs due to bias, and the street economy was 60%. Next slide. Suicide continues. As you see, the total sample was 41%. Then it gives white, Asian, Latino, Latina, African Americans, multiracial, and American Indian. Next slide, please. Transgender HIV prevalence. Men who have sex with men, often discussed alongside this group. Many trans people do not identify as men, as does myself. There should be a separate discussion. We have been discussing this for years with CDC, SAMHSA, and other places, and yet today we still find ourselves grouped in the midst of fundings, surveys, $50, $100 for men who have sex with men, and then we're told that, well, it's okay. Transgenders, you know, your sex at birth is male, so you can do the survey. And many transgenders, because of the need for money, participate, not that they identify. Higher prevalence amongst trans female population. Now, why are we vulnerable? Because of the stigma and discrimination, high-risk sex, HIV and hormone injections, and the family estrangement. And I need to speak on that for a minute. The family estrangement, a lot of people don't understand that we're seeing more and more people. And back in the years when I came out at 13, and I went through Cedar, Maple Glen, all because of being who I am under a program called People in Need of Supervision. So I wasn't afforded the ability to have the young life that I would want to have. So today I give back to my community. I mentor 35 kids in my neighborhood, and all the things I would like to have, I give to them. Next slide, please. Stigma and discrimination. Transgender people face enormous amounts of discrimination, both on a local and national level. This leads to higher HIV rates. Discrimination prevents us from accessing opportunities that others can. Pushes trans people into sex work, lower trans people's self-esteem, which leads to more stigma, sickness, and vicious cycles. And when I'm talking about this discrimination, I mean it's across the board. We talk about why are not people who are getting money saying that they want to work with transgenders, but not hiring transgenders. You know, I want to highlight like HRC. You know, I've tried to engage and, you know, working with HRC, and HRC has yet today reached out to this community that we work with in terms of what can HRC, which is a human rights campaign, what can they do for us? You know, it's always what can we do for them? But we have transgender people who are struggling, and I think that larger organizations need to figure out how to reach out to us. And I believe recently, I know that HIPS probably did get an invitation through a community group or advocacy group to figure out through HRC how can HIPS work with, or they can work with HIPS. But nevertheless, please, y'all, try to find out ways to really work with us. You know, I'm fortunate to be 61, have come through the system and been doing this for 25 or 30 years. But at some point, guess what? Miss Bud is going to be gone. Next slide, please. Unique barriers continue. Concerns over proper documentation, including matching one's name and gender to the identification documents. Some ways to support the trans, queer, intersex community and changing their IDs in Washington, D.C. Help them to obtain the proper medical forms that allow them to change their ID to the identified gender. Connect them with the assistance for changing their birth certificate, even if they have not surgically transitioned. Inform them that the Social Security Administration allows for TQI individuals in the community to change their gender in agency's database. Next slide, please. Transgender Gender Identity Respect Campaign here in Washington, D.C. I was so honored when I was able to pull this up and include this in my presentation. Washington, D.C. Office of Human Rights Campaign, during the fall and winter of 2012, did this campaign, and it appeared on more than 200 buses across the city. Was the first of its kind and the first government-funded anti-discrimination campaign focusing exclusively on transgender and gender non-conforming individuals. I thank the Office of Human Rights, and I also thank the Mayor's Office of LGBT Affairs, Director Sheila Reed, and them who are very actively involved in this campaign. Next slide, please. My contact information is Earlene Budd, of course, non-medical case manager here at HIPS. You have my contact number, my location, and also please note that ETC's Power Trans DC website is currently inactive, but it's being designed and overhauled. Also, you may reach out to us here at www.hips.org. HIPS Harm Reduction Experts, improving the lives since 1993. Let me close by saying silence to remember the life of Congressman John Lewis. I'm someone, a trans woman, who had a lot who made a difference and was an icon in our community. And I close by, I pulled one of the statements that he made, requoted of Dr. King. Why do you want your fellow Americans to be, why don't you want your fellow Americans to be happy? Why do you attack them? Why do you want to destroy the love that they hold? Want to crush their hopes and their dreams? And I send my prayers to the community and to his family, and as his funeral is going on at this time. Thank you so very much, Will, for reaching out to me, allowing me to be a part of this phenomenal panel, and I was so honored to just be a part of it, and I'm always humble to that. Thank you so very much.
Earlene Budd, we thank you very much for all of those timely and very detailed insights regarding the LGBTQ community. And particularly, we thank you also for recognizing the great John Lewis on this day. And I believe today he is being laid to rest. So your timeliness in that reminder is very well appreciated at this moment. As we want to thank all of our speakers today, Jackie Reyes Yanes, Jamilia Hampton Diggar, Imani Walker, and Earlene Budd for all of the great insights you've provided as we prepare for our question and answer period. But before we do that, and we want to remind everyone that has joined us today to please put your questions in the chat for our speakers today. I want to also give a shout out to a group of women who have been behind the scenes keeping things going very well for us here on the Zoom call. Our production team, producer Crystal Glenn, producer Deanna Green, and producer Karen McConnell-Jones. We thank these great women for keeping things running smoothly as Will Barnett and I prepare for this question and answer period. And Will, if you don't mind, I'm going to take the first question. And since we are just fresh from hearing from Earlene Budd, I want to ask this question of you, Ms. Budd. Regarding family estrangement, would you say that it is more, less time as an adolescent?
Well, for that question, and I would say it is more prevalent today as back when I came out at the age of 13. And I say that from my experience of the young people and individuals that I work with that come through HIPS, and many, if not most of the, not just trans, but LGBTQ in general. When I ask them, well, why is it you need housing? My mother put me out. Her boyfriend could not accept my gender identity. And these are young kids, some of them as young as like 17 or 18. The oldest has been, that's had conflicts, has been like 45.
Wow. Thank you for those insights. Will, what is your question?
First of all, I'd like to thank everybody. I've known Earlene for years, and Amani, I think the world of her. Jamilia, I've just met, and Jackie Reyes, I am so impressed with you all's passion for what you do. I wish we had all day, because the reality is you bring so much to the table. We can't capture it all in the 15 to 20 minutes in your presentation. I know personally that, some of you have moved mountains. You have moved mountains just based on the work that you've done. I guess I want to first question, and this can go to all the panelists. What can we do, right? Prestige or anybody who's interested in improving in meeting the unmet needs of the population that you represent. And as I see it, Earlene is the expert on the LGBTQ community. She has been doing the work for years, like as long as I've been in mental health. I remember, and I've been in the field now 30 years. I remember Earlene, okay? Amani, you have done so much work with women and children, we are lucky to have you. And I mean that sincerely, right? Jamilia, overcoming, the foster care system. It's heartbreaking to have a child walk up to you in Union Station asking you to buy them something to eat because they aged out of the foster care system and now they're living in a shelter, exchanging sex for food, for drugs, for whatever they need, because that's the only commodity they have. And that, that's not a crime. That's a survival mechanism. And unfortunately, they've had to use that. And Jackie Reyes, learning about the Latino population and all the aspects, you said you're El Salvadorian, and looking at, the needs of the Dominicans and the Mexicans and the Colombians and all the other populations that we throw together in the Latino community. What can someone do who really wants to bridge those gaps? What can we do to make things better for your population or the population that you represent? And I'm going to start with Earlene, since you're at the top.
So let me just say thank you, Will. You really touched my heart with what you just said, because that is the mission of ETC, Empowering the Transit Community. What we need, and I'm asking for, is trying to get the government, because it has to start with the government. The government meaning DHS, DBH, Department of Health. That over 24 you just spoke about, that touches my heart. I had a young man that came the other day and asked me, I told him I could give him a sandwich and a hot meal, and he said, what about some place to lay my head? I have no place to sleep. I called Adam Shelter, and they told me, Ms. Bud, we're at capacity. Most shelters due to this pandemic at capacity. I had to look at that young man and say to him, well, all you do is sit outside of a shelter. Maybe they can help you. I told him maybe just try Covenant House, may have something. But the fact is, especially for the community I'm a part of, the LGBTQ, once you age out of CFCV, community family life, all that mess, and the youth programs, guess what? There is no housing for over 24. Ruby Carrata does a good job with 18 to 24. She's tried to do adults, but no one is talking about once you age out. We've got to have that discussion, and that means it's not just one voice. It's got to be us collective, because one can't do it. It takes a family to raise a village. So that's what I need to see the Department of Health, DBH, all of us sit down and talk about how can we develop some programs, some housing for these folks when they age out. Or that the ones that are just over 24 that have no place to go. Thank you.
Thank you. Amani?
Yeah, so I think one of the things that the community needs is a substantial investment in comprehensive family-centered services. So I'll speak firstly about substance use disorder. You know, when it comes to substance use, oftentimes a mom has to make what I call a Sophie's choice. You know, do I stick it out, stay at home, you know, white knuckle it, try to take care of my kids, or do I make the choice of, you know, having to give my kids up, you know, with maybe a loved one if I'm lucky, or up to the system to go into services? That's a choice that no mom, you know, should have to make. So, you know, at this time, we do have a women's treatment program, Samaritan Ends, and I did put it in the chat. I was struggling with how to send it to everybody. Aaron had asked a question earlier, so I don't know, maybe if the technical people could help post that information. So Samaritan Ends does exist. So there is a program where a woman can go into treatment with, I believe it's 2 of her children. But when it comes to scale, you know, family-centered treatment programs need to be funded to scale. And the way that we approach behavioral health services when it comes to families is we approach it as women or adults and then the children's system. And so I think what's needed is, like I said, a really comprehensive family-centered approach at behavioral health services in general. You know, it's my experience that you know, whether it's what impacts my child directly impacts me, or what impacts me directly impact my child. So oftentimes, you know, I think about I have children who are older, and then I have my youngest son. My older 3 children and I look at it like we went through treatment together. I got my treatment services. They had, you know, their own. My youngest one was in early intervention services. My preteens and my teenage daughter, they had family therapy. They had their individual therapists, etc. But everything was family centered. We all went through the services together. Now you compare that to my youngest child, who got treatment once I was in recovery, and this is years later, and he entered into a children's program. It was like he was doing it on his own. I mean, I was there as his mother supporting him, but the other siblings were not involved. Oftentimes, the CBI worker would come to the house. I wouldn't even necessarily know that he was there. And my son isn't going to heal in a bubble, you know, he's in a family. So it was a stark difference. So that's what I would suggest, a substantial investment in comprehensive family-centered services.
Thank you. Thank you so much. Jamilia, Hampton, Diggar.
So what can we do? As an individual, we can mentor, we can provide the support, we can volunteer, we can give back. And that's what foster care youth need. They're lacking that. They're lacking those parental support. So we can fill in the gap. For me, I had lots of moms, lots of dads. At my wedding, 4 women walked down the aisle in place of my mom, because I love it. It takes a village in real life. It really takes a village. So for me, the second part of that is making sure we go back and redefine family for a lot of those young adults. Legally, there are some barriers when they're minors, when family or the lack thereof are there to support them. And so going back and looking at how we define family it's 2020. It's time for us to redefine it because they're blended families. For me, family has always been those that have supported me and been in my corner. I had coaches that were dads. And so advocacy, it is our civic responsibility. We vote not just for our presidents, but for our civic leaders and those who represent us on state and federal levels. And so we have to lobby, we have to get out there to make sure that the stories are heard, that faces are forgotten, and even the story of the young man in Union Station or young woman that you encountered, Will, those stories need to be heard. I mean, we have to compel them to vote the right way and use dollars the correct way to help those that are unfortunate. There's an organization in DC that I love to work with. It's called the Way Home Campaign, and they work tirelessly to ensure that City Council allocates dollars towards ending homelessness. And if we can be serious about organizations like that and support organizations that are pushing, that are in the face of City Council daily to ensure that they allocate those dollars, then we can get a lot of help for those in need.
And thank you so much. And Jackie Reyes Yanes, I'm sorry.
Yes, thank you, Will, for this panelist. I have learned so much. And one thing that we all have in common is that at one time, all of the panelists, at one time we were at the end and at the receiving, we were receiving services. And I think it was beautiful panelists. I have learned so much about foster care, about substance abuse, about like LGBTQ. And having said this, you guys are at the right path. We are having this conversation. That means that you're being inclusive. And I think that once we get in the mindset of what is the substance services that we need to give, that's the conversation that we need to start thinking, and that will create pathways. When the mayor, and it takes a village, because I didn't get here just because, Jackie was just, Mayor Bowser thought that she was great, right? But I had to learn to find my voice. I came, like I say, my father came here, immigrant, not worth English. The only thing that he wanted is to give her 3 daughters a good life. But because of the war in El Salvador, I became pregnant when I was a teen, and I ended up at the Latin America Youth Center. And that's how I started like finding my voice. It took time, right? So now that I'm in a place that my voice can affect services that we give, I'm always looking out for the right staff, the right team members that feel passionate and that can also put legislation towards good services. Like if I didn't think about going to this COVID-19 and thinking about if I would have been another director that I had only like came here from Texas or other state that they're here for a stepstone, right? I kept my office open 7 days a week answering those phones because I always thought, what about if my dad what's in need right now? What about if my dad was afraid that he had 3 kids and immigration can come at any time? So my 2 cents to this is we are in the pathway in the right timing because we're having this conversation, and just to having this conversation and bringing us to the table, that says a lot. Where are we going as a city? When the mayor became mayor, she said that her cabinet was going to reflect the constituents that had elected her. So we'll have a leader in the city that she not only preaches, she does what she's preaching. So having people like myself that I have come from being a teen mom, being a homeless mom, being a single mom, and coping with that, but the job doesn't stop there, because at the end of the day we're still humans, and we still have challenges that we are living on. Like, once we are an alcoholic, all the time we're gonna be alcoholics, right? So we are dealing with these things. And what I say to everybody here is thank you for sharing your story, and also that impact that you guys are doing in that job and the life mission. I don't like to call it a job. I say my life mission. My life mission is connecting to other Latino services that they, I like, maybe I'm helping a Jackie back in the 1990s growing up in DC, not knowing English, being out of their home, being homeless. So I said to you guys, you're on the right path. We just got to look at our team members having substantial programs that are going to reflect 20, 40 years from now of the of constituents that we're giving services. So I say I praise you for this work that you guys are doing and bringing us to the table, and I hope that it doesn't stop here. How can we do a strategic planning for that we can have the services that we need, the language access. And one thing that I'm very hard on my people on my team is I just don't like to make quotas. I don't like to make numbers. We're dealing with human beings here, because whoever comes in through our doors are people with needs, with basic human needs. So how do we make them feel that they are being treated with dignity and respect? That is our mission, our life mission. And whatever you guys are the next steps onto these conversations, please count them on us. And I know that Jamilia say, one of the things that I resounds me back with the services, the government services that we have. We need more people like us in government jobs, because we have to be at the table and bringing that voice that brings it's not like it's another program, it's another services. No, I would like to see that we are investing in people's life so they can become better human beings.
Oh, that's amazing. Thank you very much for that commentary, Jackie de Asianis, and all of the input that you ladies have provided. And I want to pose a question that is coming out of the chat from our CEO, John S. Smith Jr. And he would like to know, as we're continuing with the village concept and approach, how can we collaboratively work together as providers and community advocates? And what would that look like? And so we'll start with you, Imani Walker, and please, everyone else, just join in with your vision for what that might look like.
I think there's a magic that happens when you get you provide a space for people with different areas of lived experience, expertise, knowledge, and skill to come together. One of the things that I do and the work that I do currently is I really consider myself a convener. I create a safe space for family leaders to come together and develop what it is they feel is needed. So in terms of something that we could collaboratively do together, I would say, the first step is coming together and seeing what emerges from our collective, thoughts, voices, visions, and resources that we bring to the table. So that would be something that I would suggest. If it's a convening, how often? I'm not sure. That would be something that we would have to decide. We would have to decide what our priorities are. But you really don't get that magic until you come together and create it. And it's not something that, you come to the table with a set plan already in place. Because if you do, then you're not open to the magic that happens when you bring together the various minds. So that would be my suggestion.
Awesome. Jamilia Hampton?
So I agree with Ms. Walker. But unfortunately, you don't see that type of collaboration usually until there's some sort of tragedy. For within the housing circuit, we saw that with the disappearance of Relisha Rudd. We saw CFSA partner with DBH. We saw them come together, but it was only necessary to share information and bring everyone to the table at the expense of that tragedy. And so for me, a shared database and taming, like Ms. Walker said, we need to create a platform where it's necessary to have the big organizations at the table. And so for those that do housing, there should be time that there's connection to DBH and to DHS to make sure that we're all working together. Lastly, networking, coordination, collaboration, and cooperation are gonna be vital to ensure that we all can come together. And with that concept, it's not about an individual or organization, and it's more about the people that we serve.
Thank you. Jackie Reyes Yanez.
Hello.
There you are.
I'm on. Yes. Yeah, I think I said it in my remarks at the end that we need to. This is a great start that we're having this conversation, but the next steps, right? The follow-ups, and bringing in the resources, because we don't have to reinvent the wheel. You know, there's some wheels that are like maybe rusty and they needs to be a little oil, and so it keep on going. But I would like to collaborate, and you know, I agree. It's when you're given a stage, great things happen. So the next steps, you know, let me know. I'm a team player, so whatever you need, I'm here to help out.
Oh, fantastic. Yes, indeed. Erlene Budd.
So I totally agree with everything that has been said, and I'm from the old school, so I do believe that coming together with a true sense of compassion to collaborate has to be the means. It can't be that you're coming to the table because you feel like you're going to get fiscally rich and it's all about you as an individual. So collaborations for me have to be real. And I've seen over the last 30 years, a lot of people are not serious about collaborations. They collaborate with you, they get the money, and that's really what they want, and don't provide the services. So I think we have to do that and be mindful of that. But I also wanted to kick out there and say one thing, give a shout out, because I know we're in the midst of talking about Black Lives Matter and defunding the police. But when I did my webinar with the National Council on Behavioral Health, I talked about my perspective, my feelings. In DC, we are so privileged to be able to have what we call the Gay Lesbian Liaison Unit, the Special Liaison Division. And let me tell you, they have not missed a beat in terms of being here for our community, for other communities. Out in front of HIPS, there's an officer that comes, Officer Thompson, and he is known by his name now. We have individuals who are cisgender that come to me and say, where's Officer Thompson? I got a situation, I need to talk to him. That is the relationship that we need to have with the police department, where we're able to trust them and to work with them. All police are not bad. There's some that are rotten, but all are not bad. And I need to send that shout out and say thank you to the Special Liaison Unit. Thank you so very much.
Erlene Budd, Imani Walker, Jamilia, Hampton, Diggar, Jackie Reyes Yanez. Because of what you've all shared today, we certainly have improved our community resiliency today. We know as a result of this energy that we've shared that mental health matters, and truly this village, this aspect of the village that's come together today has made a impact. And so we're all going to leave this conversation better equipped to do the work that you all have already been doing, but everyone here on this call now has, I think, a few more tools in our tool box to go out and make a difference. And so we want to remind everyone who is joining us that we will be posting this video on the Prestige Community Resources website, www.prestigecommunityresources.org, and it will be up in about 24 hours or less. And at that time, you will also see posted contact information for our panelists as they provide them to us. And so we thank you for taking part in today's conversation. And we're going to prepare right now for Will Bonnet to come in to provide us with our closing remarks. Will?
Okay. I'm just looking at on my screen right now. I want to thank everybody for attending, but I really want to thank our panel participants. I have to tell each and every one of our panelists that I think you walk on water. You know, you're not just people who talk the talk, you're people who actually do the work and you walk the walk. And our communities need leaders. Our communities, we need you. I briefly stepped away from the mic so I could talk to my boss for a minute. And I really appreciate what Erlene said about people who make commitments and as soon as they get the money, they disappear. I understand that. You know, I just had a discussion the other day with my boss about, you know, doing MOUs with agencies and you end up with a paper MOU with nothing changing. And, you know, anybody can be an organization, a counselor, a representative of the downtrodden, but very few of us can affect change. And affect change means you have to have passion, you have to have the resources, you have to have the knowledge. One of the things, you know, and just as a result of what I heard today, I want to be able to do is say, well, let's form maybe a community-based minority health council. And I'll take the lead on it. Prestige, we can look at, you know, soliciting participation from all of you. And I know that probably Amani and Jackie Reyes, you guys work for the government, so you may have to jump through hoops to be able to get permission to do it. But I know Erlene, and I know she has a passion. And, you know, I've always, I'm from DC. I love the city. I love the people in it. You know, one of the things that this city has helped me with was to discover my own humanity when I was in need. Mm-hmm. You know, as a direct result, you know, it was Marion Barry saved my life. You know, he got me in treatment. And, you know, every mayor afterward has something to offer this city that helped us to improve it. So this is an evolving process. But having a minority health council that's community-based actually makes sense. You know, if it's government-based, then the community may not have any say-so about the direction, the funding, the strategy, what the work looks like. But we can take responsibility for our own destiny, for our own communities, you know, and not just wait on other people to do the work that we need to do for ourselves. And I think a lot of good can come out of that. So what I know, you know, I saw in the chat box that some people are asking, can we get the contact information for the panelists? We can post that. I know there are places like Howard University that's on the line, that other organizations that are participating today, you know, and I challenge all of, not just the panelists, but the participants, you know, to get involved. You know, my contact information is out there. Please contact me. I will at least look and talk to my boss. Everybody got one. But this is something I think we need to move forward with, you know, especially given the challenges in our community. We are pretty much out of time. There is a webinar satisfaction survey. I'm going to ask that everybody please complete it. Those surveys are very